Hi everyone, my name is Gregory. Today I would like to discuss with you facial treatment planning with Invisalign. So this case is not finished yet, it's still in process, but I want to go over the details, how I would approach this case step by step. So it will be helpful for everyone how have to approach most difficult cases like full rehabilitation cases, even the simple one tooth procedure in your office. So this patient came to my office with chief complaint that she doesn't like her bite, and she has a cross bite on her left side, and her midline shifted to the left, to the patient's left. She doesn't have any concerns, symptoms at this point, except the position of her teeth. She doesn't have a TMJ problems. She doesn't have problems with her bite and everything else. So this gave me the idea that after the clinical examination also that's it's going to be a simple case. We have to reposition her teeth. So how to approach the case? We have 10 steps in the treatment planning, where and how I should supposed to position the teeth of the patient. So the first 4 steps are more important. The first steps is where to position your upper anterior teeth. The second is going to be posterior teeth on top, then the lower anterior and the lower posterior. So when we know that where to position the teeth of the patient according to your face, then it's going to be easy for me to put the prescription for Invisalign where to place the teeth. A little bit easier outcome. Even if, for example, I'm doing full rehabilitation case and I'm doing with my technician, and or let's say different cases, so I tell my technician what my reference point is, like my tooth number 8 or number 9 or something else, and according to that point, it's my technician will do the wax up or the final restorative stage. What are those 2 pictures are most important I'm looking for? The repose picture. The repose picture is helping me to establish the position, especially the front teeth. And I look at the canine position. The canine position has to be at 0 level, or the +1 or ±. So depends on the position. Again, those canines are the most stable teeth in the patient's mouth, or to put a reference on. So we can see that if the patient has a vertical maxillary access, or they need the ortho, or we need a combination of surgery and plus ortho. So in this case, I chose that number 8 is most reference point for me, and the canine you can see on here left and right in different position, but if we're going back to these pictures, we can see that number 10 position more up and more buccally, so because it's a crossbite. So when I find out it's the position again, it's my front teeth right here, then I establish the position of my posterior teeth. In this case, I didn't change the posterior teeth position. We have to work only with the front teeth. This picture is also reposed, but with open bite. It gives me the idea what to establish the lower anterior teeth, if they are looking right to the face. How about the posterior teeth also in here? So in this position, and this picture, what we decided is to alter it a little bit position of the front teeth, mesodistally and buccolingually, not touching the posterior teeth. So it means if we're not touching upper and lower posterior teeth, the vertical dimension is going to be the same, and we have to work only with the front teeth. So the next picture is a Ceph. The Ceph is also giving me the idea when I'm collecting the data with all the information I have from the pictures. Give me the idea also the position my front teeth buccolingually, and when I see the interincisal angle between upper and lower teeth, the position of the molars towards the face and the skull. So putting all these things together, Now I know that what probably I'm supposed to put in the prescription for Invisalign to achieve the better result. If, for example, I'm sending this patient to orthodontist doing the Invisalign on the regular braces, and after the procedure I have to do my restorative stage, what I ask my technician is to do lock-up on a model where I want to put the teeth in the position of the final outcome after the braces, so the orthodontist will know according to the template. They have like a matrix template, a silicone template, wherever you choose. They know where to position the teeth. Of course, we can have a discussion with the orthodontist what the final outcome would be and would be possible. So in this case, we can see the next picture was the patient's refinement stage. How did I achieve the result? We can see we established the midline properly. We have a little bit inclination of 89 towards to the left, but it's because sometimes there is problem with the Invisalign to move those teeth tardily, and they usually tilt the teeth now to make the correction. But the most important, we can see that the crossbite is eliminated, and the position of her 10-11 in much better shape right now. But we can see from the MIP at this picture that we still have to work with the lower and upper front teeth to establish a little bit better position, so the patient will end up with a beautiful smile. And also paying attention to what the gingival level of my upper anterior teeth, because that's what the most important for the patient aesthetically. So make sure the gum level are going to be almost the same level. So my point is here that I'm trying to put number 6, number 8 and 9 and number 11 at the same gum level, and number 7 and number 10 a little bit more a lower position. So if, for example, I establish the bite, even the position of the gum, I might probably do just incisal, adding the composite or with the laminate, depends what the patient wants at the end. But that's what my stages are to probably to achieve the result, especially in this case. Thank you very much.